Hi everyone, I'm Margie Baxter and I'm going to be talking about social marketing. Let's define social marketing. According to Andreessen, social marketing is the application of commercial marketing technologies to the analysis, planning, execution, and evaluation of programs designed to influence the voluntary behavior of target audiences to improve their welfare and that of society. Three important components of social marketing. First, involves the utilization of a marketing perspective in order to impact voluntary behavior for individual and social good. A primary feature of social marketing is the focus on improvement in personal and social welfare. Finally, it involves a mutual fulfillment of self-interest through voluntary exchange. How is social marketing different from commercial marketing? Commercial marketing is in the marketer's best interest. In social marketing, the consumer and the marketers share the same goal, increasing benefits to society as a whole. Principles of social marketing. The first principle is focusing on behavioral outcomes. Social marketing prioritizes consumer benefits. It maintains an ecological perspective. It involves developing a strategic marketing mix of communication elements utilizing the 4 Ps of marketing. Finally, identifying consumer differences that affect responses to goods and services. Prioritizing consumer rights. Social marketing campaigns benefit society in the form of behavior change, stable environments, or cleaner air. The government agencies that promote these programs do not derive immediate gains except through a healthier society by lowering the burden of disease and reducing public health resources. The ecological perspective. Consumer orientation revolves around consumer needs and desires. The functioning of markets is dependent on the flow of information about products that are available, what they cost, how they can be used, what benefits they provide, and where to obtain them. Promoting products always face competition for the consumer's attention and resources in a dynamic marketplace of ideas, priorities, and choices. Upstream focus on infrastructural change involves things such as policy or regulatory change, or a downstream focus on individual change, such as changes in knowledge, attitudes, or practices. Social marketing mix in the 4 Ps. Product benefits, price, perceived cost or barriers, place, where the consumer is reached, and promotion, communication, and messaging. Social marketing audience segmentation. The use of social marketing strategies that target subgroups within a community. This can be done through the use of socioeconomic, cultural, geographic, psychographic, and age characteristics. Audience segmentation can also be done through patterns of use: frequent, infrequent, experienced, and inexperienced. There are 3 principal domains of health communication. The first, the socio-political environment. The second, health service delivery system. And the third occurs in individuals and communities and households. Domains of health communication. These domains can be combined or independent to facilitate change that creates environments that are conducive to supporting health services and preventive practices. There are 3 approaches based on needs and resources. These are product-driven approaches, consumer-driven approaches, and market-driven approaches. Is social marketing a theory? Social marketing is not a theory, but a strategic approach to social and behavior change. However, social marketing uses theories to understand people and design strategies to support change. The following article will illustrate a social marketing campaign based on the trans-theoretical model of behavior change. The research article that I chose, Golden Moves, Developing a Trans-Theoretical Model-Based Social Marketing Intervention in an Elderly Population. Inactivity in the elderly. This study occurred in England. Only 17% of men and 13% of women aged 65 to 74 are considered physically active. Inactivity in the senior population is linked to premature death, lower quality of life, and increased healthcare costs for the individual and society. Aging should not be regarded as an affliction. It is a stage in life, like all others, that deserves to be celebrated and documented in all its natural grace and beauty. According to the World Health Organization, physical activity improves the quality of life of the elderly by lowering blood pressure, decreasing the onset and progression of osteoarthritis. It does help control the symptoms of arthritis and osteoarthritis. It promotes psychological well-being and increases brain function and decreases dementia. Social marketing, the impact on the individual. Conservative estimates rate lack of physical activity as the underlying reason for 22% of cases of coronary heart disease, 16% of colon cancer cases, 15% of diabetes cases, 13% of strokes, and 11% of cases of breast cancer, as well as 5 to 8% of premature death in the United Kingdom. Social marketing, the impact on the nation. According to the World Health Organization, the National Health Service of the United Kingdom spent $1,773 billion annually on coronary heart disease, stroke, diabetes, and cancer of the breast and colon due to inactivity. The intervention. Participants. 4 exploratory focus groups that had a total of 24 participants between the ages of 65 and 75. These individuals were predominantly white-collar backgrounds. They were recruited from family physicians, and they were deemed healthy enough to engage in physical activity. All the participants were white, 15 were female, and 9 were male. The average age is 65. The method for this research article involved focus groups that lasted 60 to 90 minutes. All of these groups were videotaped and transcribed. All the participants received a $10 incentive to take part in the study. Each focus group was led by researchers using semi-structured questions. The focus groups were divided into 2 stages. Stage 1 involved the current views on and barriers to physical activity. It also investigated the role of potential influences and facilitators. And it also involved the relevance of current and potential future messages and media channels. Stage 2 involved how social marketing interventions could work in practice. This intervention is modeled after the trans-theoretical model of behavior change by Prochaska and De Clementi. Why use the trans-theoretical model? Well, the trans-theoretical model effortlessly adapts to individually delivered interventions. It's also an evidence-based research that has shown that this model is to be useful in a diverse range of issues. Results from the first stage of focus groups. The data was transcribed and emerging themes were identified using a grounded theory approach. Navio was used to organize the data. 3 themes emerged: knowledge of the benefits of physical activity, current exercise behavior, and perceived barriers. Participants had very little knowledge of the benefits of physical activity in older adults. They were unclear on what constituted formal exercise. However, all participants engaged in some form of physical activity. Here are some example responses from the participants. I don't do regular exercise. I do go to the shops. I walk everywhere, do household chores, just normal things. I walk, I'm active. I could walk more maybe. What is classed as exercise? The following exercise recommendations for people over the age of 65 involves moderate aerobic exercise for 30 minutes, 5 times a week, or vigorous exercise for 20 minutes, 3 times per week, in addition to flexibility and strength training. The current physical activity levels of the majority of the participants saw themselves in the pre-contemplation stage, or for a few in the maintenance stage. Social support for exercise. Lack of social support is attributed to giving up exercise or not beginning to exercise. Conversely, active participants attributed social support a critical factor in maintaining an exercise program. For example, I've always enjoyed sports. My friends have always enjoyed sports, and we still do yoga together. Medical professionals. Inactive participants felt that encouragement from healthcare providers would encourage them to begin an exercise program. These findings illustrate the importance that healthcare workers play in the pre-contemplation phase. A strong preference for grassroots or word-of-mouth social support emerged. In particular, branding or targeting that emphasized keeping young or keeping active while avoiding an old people image. Messages and channels. The majority of the participants felt that current messages targeted young or middle-aged audiences. It's all about young people, really. Other messages that were disclosed include the health benefits in later life seem poorly communicated. The majority felt that the focus was on the cosmetic benefits of exercise. The messages they responded to positively involved keeping active, keeping young. Preferred channels of the participants. Personal messages were preferred. Messages that were relayed during routine appointments. Technology-based monitoring. The level of self-efficacy is associated with a need for more personal contact and guidance. The summary of Stage 1. Advertising and mass media communication is mostly dismissed as ineffective. Positive role models and portrayal of active seniors were considered useful. What worked in this study? Media channels paired with proactive social support, such as positive attitude from healthcare providers, emerged as the most promising way to change attitudes towards physical activity. Key messages that include health factors. Keeping young are the preferred message frames. Here is an example of a potential intervention model. As you can see, the stages listed: pre-contemplation, contemplation, preparation, action, and maintenance. Now for each one there is an intervention. For the first, pre-contemplation, product placement in relevant media channels, healthcare professional highlights, and benefits of physical activity. And the process involves conscious raising. Within contemplation, the intervention involves revisit the positive health effects and evaluate the stage change, and this could occur at a health appointment. The process would be environmental reevaluation, dramatic relief, or social liberation. During the preparation stage, the intervention would involve a healthcare worker who perhaps designs a personalized fitness program and includes step-by-step checking of potential barriers. The processes involve environmental reevaluation, dramatic relief, social liberation, self-evaluation, and developing helping relationships. The action stage involves personal or telephone follow-up to ensure positive messages are not getting lost. The process involves reinforcement management, counter-conditioning, helping relationships, and stimulus control. And finally, the maintenance stage involves regular or routine health checks and helping relationships and developing stimulus control. So, what have we learned? Social marketing is used in the delivery of public services by engaging the community, designing and implementing interventions, and potentially delivering social change and meeting policy objectives. A key aspect. Through the use of the example, reducing inactivity in the elderly, we gained insight into the motivational factors behind adopting the desired behavior. The study showed that people over 65 are a distinct group from the general population. Common misconceptions from this group include common perceptions of physical activity and symptoms of physical activity are negative or unhealthy. Ideal messaging channels for this population involve general media channels can be used to create positive role models. Healthcare providers play a crucial role in message delivery. Cooperation of healthcare workers is critical to the success of a social marketing campaign. The model for this study presented a one-on-one intervention using the trans-theoretical model delivery in a healthcare setting. This form of intervention has the potential for successful outcomes. However, at the first stage of the study, the researchers discovered misconceptions at the societal level. The trans-theoretical model would not efficiently influence these factors. Other models with a broader, attitudinal, and belief-based constructs would complement the trans-theoretical model-driven intervention more effectively. The limitations of the study were as followed. This study relied on the use of qualitative data, especially from focus groups, which may influence participants to be unwilling or unable to discuss all the factors that affect their behavior openly. Due to the limited diversity of the participants, this study may not be generalizable to other populations. The relevancy to health education and behavior. The United States has reached a new milestone, a population of over 50 million seniors for the first time in the history of the U.S., according to the Center for Disease Control. We need to strive to meet the demands of a growing, diverse, racially and ethnically aging population. Impact. Understanding the lifespan contributors to aging is critical, as we are experiencing a genealogical explosion of adults nationally and internationally. We must recognize that individuals are now living longer and enjoying more years of an active lifestyle. The incidence of disease, while still high among this group of adults, is now more likely to be managed with improved health care and access to services that was not readily available some years ago. As health education specialists, it is time we address the topics pertinent to the well-being of the adult population, such as work and retirement, social networks, context and neighborhood, discrimination, health disparities, long-term care, physical functioning, caregiving, housing, and end-of-life care. Bringing our knowledge of this understudied group in line with their needs and the impact they will have on society will be an achievable challenge for future health education specialists. Here are our 2 talking points. Number 1, what are we doing as a society to make sure that we adapt healthy lifestyles now to assure an inexorable transition into old age? Number 2, what other theoretical models would complement this type of intervention? Thank you, and I hope you enjoyed my presentation.